Prexney's on. Prexney was an intern last year.
This is beautiful. If possible, if you're in a safe space and you feel comfortable, we're going to ask folks to share their video, at least just for the first 5 minutes or so as we do the introduction. If you can't, no big deal. But the faces we see are a beautiful tapestry that reflect our community. So we just want to recognize and celebrate that. So I know some folks are at work and some folks are driving, hopefully being safe. And also keep in mind, if you're hesitant to share because your background may be messy or there may be kids and puppies everywhere, part of our radical welcome is we want you to show up as yourself. We want all of you to show up. So for this session, perfection goes out the window, all right? We say that showing up is enough and you're perfect, whole, and complete. Thank you, guys. Mary Ellen, we still have some, I'm still admitting some more folks, and you guys let me know when to start.
Well, it is 4:01, Hassan. Are there others waiting in the waiting room that maybe?
Yeah, I'm checking. I'm gonna give them a couple more minutes. We'll start in just a moment. Yeah, we got a couple more coming. So at this point, we have 41 people. Welcome, 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 welcome. We are excited for you guys to join us. We think about the fact of all the places you could be in the world that you have chosen to be right here with us for this phenomenal experience. My name is Hassan Batts. I want to welcome you. I do something that's called radical welcome. So I do want you to just, and we want this welcome to be active, right? So I want you to take a moment and just look around the screen so that you can see what I see. And I spoke to this a little bit earlier, but it's like there's this beautiful tapestry of the future of healthcare. So they're the folks that are in the field. They're the folks who are the giants whose shoulders we stand upon. And also we want to recognize the ancestors that paved the way, right? So we welcome you. We welcome you to bring all of yourself to this conversation, to embrace the opportunities that are before you, and to continue to contribute to health equity. We're at a place and a moment in time where our world is different. There's a lot of uncertainty, and it's through us all coming together with intentionality to change the disparities that exist. So thank you to everyone that joined us over the summer. Thank you to the folks that are joining today. Thank you to everyone that contributed. And we want to, again, give a huge radical welcome to you and let you know that you made the right choice to be here with us. So with that, I'm going to hand it over.
I echo Dr. Batts' sentiments. My name's Mary Ellen Miller. I'm the director of the Lehigh Valley affiliate of Bridging the Gaps. Dr. Syria Lang, who spearheaded a movement this summer on a health equity project where the interns attended a health equity seminar every Monday afternoon, is not able to be with us this afternoon because of her commitments at Lehigh University, but she did record a video. And we have that we want to share with you. So Dr. Batts, do you have access to that?
No, Ola has it. Ola will cue it up. I do want to also invite you to use the chat feature. We want this to be interactive. We want to capture moments that have really stuck with you, questions, comments. So if you could use the chat feature for that, that would be phenomenal. And we're all learning this together, right? We're learning how do we build community virtually. So we're accustomed to doing this face-to-face. So if periodically you can smile or throw a thumbs up as the students are talking, just to let people know that you're present and that it's resonating. There you go, thank you. All right, Ola, are you with us? Hopefully she's pulling over.
Yeah, she informed us that she was driving, and she's our community preceptor that has the video. Here we go.
Everyone. Uh, I'm sorry that I cannot be with you in person, but I wanted to record this short video to talk with you a bit about health disparities and health um, inequities, and to in motivate you as you go out to do your work about what it means to really focus on achieving health equity. So I've talked about this before with some of you. Health disparities are really just differences in health outcomes, in the incidence and prevalence of disease, in the burden of disease and other adverse health conditions that exist among different populations in the United States. And health disparities are often health inequities because groups of people who persistently experience discrimination and social disadvantage are doing worse. And so health inequities are differences in health that are unfair, that are unjust, and that are avoidable. Okay? So we can do something about them. There are so many areas, so social statuses that are associated with health inequities. Race is a significant example, right? So people who are black, who are brown, who belong to racially marginalized groups experience a greater burden of disease, a greater burden of health-related outcomes than people who are white. There's socioeconomic conditions that also matter for health. There's income, education, wealth, there's occupation, there's neighborhood. Then there are issues like gender and disability. There are issues like age, geographic location, immigration status. All of those things matter for health, and they are entangled in the web of causation. So it's not by accident that black people in America have the highest death rates and lower life expectancies compared to white people, that black people have a higher mortality rate for 13 of the 15 leading causes of death in the US, right? And that infant mortality rates, for example, among black children is more than twice higher than infant mortality rates among white children in the US. And that diabetes, for example, which is one of the leading causes of death, that Latinx populations, Latinxes, are more than 2 times likely to die from diabetes compared to their white counterparts, have greater rates of high blood pressure, obesity. All of these things are linked to our structural and social conditions that shape health outcomes. And so it's really important for us to think about the ways by which the society is organized that matters for health, right? So there are explanations for health inequities. The explanations are really in socioeconomic disparities or differences in access to resources. Okay? Differences in access to resources that matter for health, right? So if you think about racial health inequities, there are two main reasons for that. The most significant reason and the fundamental cause for racial inequities in health outcomes is racism. It's really that simple, right? So people of color, there's nothing inherent in being black or in being Latina or in being an indigenous person that affects your health. There's nothing about your genes, about your biology that matters for your health. There's everything about how the society is structured that increases chances for poor health outcomes. Right? So we talk about racism as a fundamental cause for racial health inequities. And a lot of us think about what racism really is and what it's not. And so remember that racism is an action or an idea or an attitude that can be intentional or unintentional, that is based on the person's skin color, and that is grounded in the fact that people with a particular skin color should be subordinated, should have limited access to resources, and people with a particular or different skin color, so people who are white, should have more access to resources, should be more valued. Racism can be individual, it can be institutional or systemic, it can be conscious or unconscious, and it can also be internalized. The ways in which racism affects health, I want to talk really briefly about that. The first is through institutional discrimination. So it can restrict socioeconomic attainment and create racial group differences in health outcomes. So people might experience discrimination at their work, at their schools, in their neighborhoods. Those matter for whether they get jobs that would give them access to resources that matter for their health. Racism shapes health through segregation. So racism creates poor conditions in disproportionately black and brown neighborhoods that then limits access to opportunities, access to medical care, limits people's ability to engage in healthy behaviors. Racism causes poor health directly through racial discrimination. Right, so people experience discrimination. They don't have access to resources or services because they are just not allowed to based on the color of their skin. Racism can then create conditions that increase exposure to other traditional stressors. It might create conditions that might increase exposure to police brutality, for example, which is one of the oldest forms of structural racism. Racial discrimination is a psychological stressor. It affects your well-being. It gets under your skin. It makes you sad. There's just that feeling and that knot in your stomach when you experience discrimination based on race. And it doesn't not affect your health. It affects your emotional health, but it also wears and tears other body systems and functions in ways that matter for your health. So if you think about everyday discrimination, the number of times that people are treated with less courtesy than others because of the color of their skin, with less respect than others, receiving poorer services than others. People act like people of color or black people or Latinx and indigenous people aren't smart, act like they're afraid of them, act as if they're dishonest, harass and insult them. All of those things matter, and people experience that every day, especially within our healthcare settings. We've done work in the Lehigh Valley that demonstrates that Latinx populations in the Lehigh Valley and black populations in the Lehigh Valley often worry about their encounters at the healthcare settings. They often feel devalued, dehumanized. They feel harassed. They feel like, our healthcare providers don't think of them as honest, as respectful. They receive poorer services. These things don't just happen in their heads. They are actual experiences that then limits engagement with our healthcare systems. So it's important to think about how the experiences that people have outside of the healthcare setting shape experiences with the healthcare settings, because our systems are really interconnected, and those are some of the ways in which structural racism affects health outcomes and increases health inequities. One of the things that I want you to remember is that inequities in health are large, and that they are pervasive and that they are persistent over time. They've been existing. They are not new. They are everywhere. They don't just happen in clinics in Allentown or in clinics in specific areas. They happen everywhere. They don't only happen in clinics that serve disproportionately brown people, disproportionately people who are of lower socioeconomic status. They happen even for people who have relative access to resources like myself, that my experiences in the healthcare system are not the same as experiences of people who are white. So it happens everywhere in all kinds of clinics. I also want you to remember that racial inequalities in health, or racial inequities in health, are created by larger structural inequalities and inequities. So social inequities often create health inequities and vice versa. So they are interconnected. And that when it comes to racial inequities, that racism is a fundamental cause. I want you to also remember that eliminating racial health inequities requires us to acknowledge and document the consequences of racism, right? To think about the negative ways in which racism affects health outcomes. We are not going to address racial inequities in health without talking about and without addressing racism. And we cannot address racism without thinking about people who perpetrate racism, racist actions, and racist policies. Racism doesn't exist without people and without policies. We have to talk about all of those things. Students often ask me what they can do. I think it's important to understand the history of the United States, to think about even how residential segregation created inequalities and inequities in the kinds of care that people received in the different neighborhoods where there were healthcare facilities. What do those facilities look like, for example, in Allentown versus facilities that are in Coopersburg, Pennsylvania? So we have to understand the importance of history and the history of residential segregation in creating that. we have to also break out of our individual bubbles, right? So a friend always said that the only person that you can change for sure, that you know you can change, is yourself. So you have to commit to doing the personal and the individual work to change and unlearn the ways that you have been taught or trained or seen the society treat people who are black, treat people who are brown, right? People who don't look like you. You have to just think about the people that you interact with. Think about your own networks. Get out of your bubbles and get to know people. And then we also have to challenge the narrow focus on the individual. It's not really about individual healthcare providers, even though individual healthcare providers matter and they should do the work of becoming anti-racist. But we can't just focus on an individual. We have to think about how our systems work together to create inequities in health outcomes. We have to think about how our society, our healthcare systems are organized. We have to think about the policies and programs that inform our day-to-day actions in terms of delivering healthcare, how those things matter for creating inequities, and not focus on the one provider who you think is racist, the one nurse who made a racist comment, right? So think about yourself and then think about the broader system. Not think about this person or that person. Think about what role you play in creating or in sustaining racism, and then think about how that interfaces with the broader system and how we can change. And then view systems as structures as things that are modifiable, that we can work towards making changes. Don't ever think about race as sort of the risk factor. Think about racism as the risk factor. Don't think about an individual as a bad provider. Think about the entire system and structure as what is bad and as what we can ultimately modify. It's not okay to say this is how things have always been, because we make things the way they are, and so we can make things to work differently, and we can try to change that. And then try to, in your clinical practice and in your day-to-day, try to expose the myth of meritocracy. There's no good patient or compliant patient or non-compliant patient. Think about the structural factors, the inequalities that people experience that make them more likely to engage in care, and address those issues rather than saying this is a good patient, this is a compliant patient. Think about what it means in terms of having access to resources that really works. If you're developing a treatment plan, think about what potential barriers that patients might face and address those barriers. Ask people about what those barriers might be. Get to know people's experiences and their abilities to follow to follow a treatment plan. The last thing I'll say is that you should question policies and programs. Don't take anything for granted. Again, this goes into don't just assume that things are always going to stay the way they are. Question policies, question programs, think about how it's disproportionately affecting people. So thank you so much. This is all that I really have to say to you guys. And one last thing, even though I said before that I had the last thing, this is the real last thing. I think you should make it a habit to listen to people who experience inequities, who are closest to the pain of racial inequities, who are closest to the pain of racism and other structural injustices, and learn to listen to them and take their experiences as fact, and treat those experiences seriously and act accordingly. Thank you guys so much, and I hope that you enjoy the program.
Okay, thank you so much, Ola, for sharing that video. And there were some chats that were going up, and we'll be addressing everything at the end of the session. Ola, are you able to share the screen with the PowerPoint now for the Bridging the Gaps internship?
So Mary Ellen, you actually are able to share the screen as a co-host.
Oh, good.
Yeah,
I have it pulled. I have it pulled up. I have it pulled up. Let me find it. It's a part 1 and a part 2. Okay. All right. And then there's a way I can get it where it's a slideshow. But I'm looking here. Slideshow.
Yep, play from the beginning.
Perfect. Okay. Thank you for helping me out. I just wanted to mention that a few of our very important supporters for the 13 summers that we've been doing the Bridging the Gaps internship in the Lehigh Valley area are on the symposium session tonight. And I wouldn't want to start with the entire presentation without asking them to introduce themselves and say a few words, as we've always done when we had our symposium as a poster symposium at DeSales University with the affiliating schools. So I saw that Dr. Mary Liz Doyle Taduni, who's the division head of nursing, is on the session. I'm wondering, Mary Liz, if you can hear me?
Sure.
Thank you. There you are.
Hi, how are you? Hi, everybody. I'm Mary Liz Doyle Taduni. I'm the division head of nursing at DeSales. And wow, I mean, I can't tell you what a fantastic event this is and gathering. And I'm so sorry we couldn't be in person, because I love just going to these annual events that we have at DeSales just to see what the students have done. And I have to just say how wonderful the preceptors have been. And I see a lot of you here just looking through all the different faces. And it's just been such a wonderful thing for our students, our DeSales nursing students. And can I tell you, we're putting together our report for accreditation. I'll just say this really quickly, so I know we don't have a lot of time. But so Mary Ellen, thank you, Mary Ellen. She sent me everything that has been done with DeSales nursing students the past 5 years. And it's just incredible, the impact that it's had on our students. And it's made them think of areas of nursing that they never thought of practicing in. So I just want to thank everybody on this Zoom call that we have today for everything that you're doing to keep this going. It's just such a wonderful thing. So thanks, Mary Ellen.
Oh, I do want to thank you for all your support all these years.
And thank you, Mary Ellen. You've been dynamite.
And we couldn't do this as a solo practice because this is an interprofessional internship. And so we've partnered with the medical studies and PA program at DeSales University. And I did see that Dr. Wayne Stewart was on the call, and I'm not sure if he still is. And Kathy Earhart is. So Dr. Stewart, if you're on, if you wanted to say a few words, as you always do at our symposium, and if not, I'm going to ask Kathy. Professor Earhart?
I don't see Wayne on anymore, so I just wanted to say thank you. Our students have a tremendous experience with Bridging the Gaps, and I wanted to thank everyone who has been involved with this. I'm always impressed with their presentations and the posters, and it's a wonderful way for them to get experience. And I agree with Mary Liz that they find interest in areas of medicine that they hadn't thought of before. So that's very, very important, and obviously bringing care to those who need it. Thank you.
Thank you so much, Professor Earhart. And we have other schools. Moravian Nursing has been with us for 3 summers, and the chair of the department there, Dawn Goodoff, is on. Dawn, are you available to say a couple words?
Sure. Hi, everybody. And thank you for the invitation and allowing us to be a part of this. My name's Dawn Goodoff. I am the chairperson for the School of Nursing at Moravian College, and I am new to this position. I'm fairly new. I've been in this position for a year, so I'm really excited to be here live tonight to see this, as I know all the great work that's been accomplished over the past several years, and am very thankful for the opportunity to be a part of it. So thank you.
Thank you, Dawn. And we've always had excellent students from your school also. And I believe I saw Marywood, Christina Giglar. I saw her signed in. If she could say a few words about the master's program. Christina? Okay, maybe she stepped away. And last but not least, we've been generously funded for the entire 13 summers from the Lehigh Valley Health Network Department of Education. And Mrs. Maggie Hattinger is on the session here tonight. And I especially want to acknowledge her ongoing support for us. But I also wanted to ask Maggie to say a few words, as she does usually at our symposium. That's a poster session. Maggie?
Hi, Dr. Miller. Thanks for the opportunity to say a few words on behalf of LVHN and on behalf of our Chief Academic Officer, Dr. Bob Rocca, who I think is on but needs to get off in just a couple minutes, and our Vice President for Education, Dr. Cindy Capel. We have been supportive of and celebrating the Bridging the Gaps program since its inception here in the Lehigh Valley. And so it's always a real shining example of what can happen when some really committed people get together and decide to do something a little bit different. This year was a chance to make lemonade out of lemons. And so we converted the entire program to virtual. So I want to do a special thank you to Dr. Botts and his team and all the community members and his staff who really worked with Dr. Miller to make that possible. You know, a program like this isn't possible without a lot of people pulling together. But Dr. Miller, you're really the glue that holds it together and the spirit of the program and the backbone of it. There are lots of people on the call. I'm seeing lots of familiar faces, people who have been supportive over the years. And so thank you to the shoulders that really this program is standing upon. So thank you on behalf of the entire team. And students, this hour is yours. We want to see you shine. So I look forward to seeing your presentations. Thank you.
Thank you so much. And again, for your ongoing support. Let me see if I can move this along. Bridging the Gaps in the Lehigh Valley, a brief overview. Our first group of interns was back in 2009. We had 4, 2 nursing and 2 medical studies majors. But over the last 13 years, we've really grown. We've included medical students from Commonwealth College for 3 years, nursing majors from Moravian since 2016, MSW students from Marywood for the last 3 years, and this is our first year with a medical student from Temple University through the St. Luke's program. So we were thrilled to have that occur. The interns by major for our stats are listed here. I won't read them all out, but you can see we have nursing, medical studies, medicine. We had 1 master's in public health student in our second year from East Stroudsburg, and the MSW students for a total of 98 interns over these 13 years. But when you look at what those 98 interns accomplished at their community sites, we've given almost 3,000 hours back to the community to really partner with them and to intervene with different types of programmatic activities that really benefited not just their community organization, but the education, the interprofessional education of the interns. And this would not be at all possible without the anchor of the main Bridging the Gaps program that started 30 years ago in Philadelphia. And I know that Lucy Touton, the executive director, I saw her listed on the little postage stamp photos of everybody we see on this call. So Dr. Touton, can you say a few words if you can hear what I'm saying right now?
I'm just very thrilled to see the growth of this program. Abby Letcher was a medical student in the very first class that went through Bridging the Gaps 30 years ago. And Mary Ellen Miller was at LaSalle long ago, and she was a faculty member. And it's just so exciting to see another growth of Bridging the Gaps. And I also want to say that to you students who are such an incredible group of contributors to this program, that we really thank you. This summer has been extraordinary. We moved it to virtual, we moved the service to virtual, we moved the curriculum to virtual, and I think that the students were so engaged and gave so much and really thought very deeply about their place in the world and their place in their profession. And my hat is really off to all of you because this is not an easy world right now. And it's wonderful to have people who are thoughtful, who want to grow, who want to really look at the issues that were just discussed and really try to make a contribution. So we thank you students, because without you, there would not be a future. So congratulations to all of you, and we really look forward to seeing where you go in your careers and for you to be taking care of this world, which needs a lot of taking care of right now.
Thank you so much, Dr. Thank you so much. And you mentioned Dr. Abby Lecter, who I was holding off till the end to introduce, but she is going to do some commentary for us this evening too. But I could not have gotten this program off the ground way back in 2009 without the assistance that I had with the partnership between Dr. Lecter and Maggie Hattinger. So just want to say thank you. Okay, the pandemic summer, we had a virtual internship through the Promised Neighborhoods of Lehigh Valley. I can't say enough to Dr. Hassan Batts and Ola Anawalo about being the community preceptors and allowing us to have 6 interns based at their one neighborhood site. It was very challenging because in the past we've done summer camp programs for Bridging the Gaps. We've done clinic settings. We've done a homeless shelter, and either the camps weren't running or the homeless shelter was so inundated they couldn't have a virtual, experience. So it's just very much a blessing that the Promised Neighborhoods of the Lehigh Valley were the ones that were able to open their doors to us. And I and the interns will be forever grateful for that. So now all the interns will highlight their summer experiences. Abby Dugo from Temple University, Dan Phillips from Marywood, Charlene Weiner from Moravian, Chelsea Budde, Emmeline Cruz, and Noel Kelly, all from DeSales. So without any further ado, let me turn it over. Abby Dugo is going to start.
Hello, everyone. My name's Abby. I'm a second-year medical student at Temple University in the St. Luke's program. First of all, I also just want to give out some thank yous to Ola and to Dr. Batts for this summer. It was really hard doing it online, and that's not something that any of us anticipated when we signed up for this program. So that was a little concerning going in, but I just want to really thank them for making it such a meaningful program. They did a great job having an online program this summer. So thank you to them and to Dr. Miller for all of her work in coordinating all of us. So this summer with PNLV, I worked with Chelsea, who I think is going to talk next, about we created a project on social isolation for PNLV to use for their learning management system. So we focused on isolation, and it was especially relevant right now with COVID, making more people isolated than would originally be. So it felt especially relevant. And what we did was we did literature searches to find our background information, and then we used a community-based participatory research model in which we interviewed content experts, which are those who have studied the areas that we were focusing on, as well as context experts, which are the communities who see the problems and solutions in their community and how these issues apply specifically to their community. So we conducted a lot of interviews to gather our information, and we put together a presentation that talked about what social isolation is, how it affects your health and well-being, specifically how it relates to Allentown and the Allentown community. And we also included a ton of resources, both national and local, for people to utilize if they're experiencing isolation. Another thing that we incorporated into this presentation was a piece on smoking cessation, which is one of the Bridging the Gaps focus areas for community health. So in a similar vein, we gathered information on some statistics about smoking in Allentown and resources for quitting, including harm reduction methods such as nicotine replacement therapy, and resources for quitting, as well as some testimonials, I guess, of community members and why they decided to quit. We thought that that might make it more relevant for people in the Allentown community. In terms of other work we did with PNLV, we helped create an annotated bibliography after doing literature searches on police reform and police brutality for PNLV to create a proposal to present to City Council. I was also the student coordinator for the Lehigh Valley program. So I'm gonna post in the chat the website that I have here. So what I did as the student coordinator, one of the things was I helped to compile all of the Bridging the Gaps interns projects on the community health projects that they did. So These projects focused on areas of cardiovascular health, oral health, and smoking cessation. And myself, along with the other student coordinators, compiled them into a website that we made. So you can check out the website there. I posted a picture of the homepage here. We have different tabs for all of the different focus areas. And the students really did a great job of creating resources in each of these areas, both for Philadelphia, just general information, Lehigh Valley resources. So that was great to see all the work that all the students did. And finally, my reflection on my experiences this summer. This summer has taught me humility, which is important, of course, for my future as a physician. I've spent years studying social determinants of health in college, and this summer taught me that despite all of that, I'm not the expert. The experts are the people who are living in the community and know the problems, the ins and outs every day. I'm meant to serve as a resource to help them overcome those problems and brainstorm solutions. And it's not really the place of any outsider to decide what the community needs. So I hope to carry this ideology with me and apply it to my job and just my interactions as a community member and neighbor in my future. Thank you.
Thank you so much, Abby. We're going to move on to Chelsea Budde, who was Abby's partner. And why isn't it moving forward?
Thank you, Abby. That was great.
There we go.
My name is Chelsea Budde, and I'm a nursing student at DeSales, a senior nursing student, actually exciting. In 7 weeks, I gained a perspective I didn't have before. Bridging the Gaps sparked a drive in myself to make a difference. This summer, we listened to weekly webinars, interviews, and seminars, and I had the opportunity to listen and learn. We listened to community leaders, educators, students, advocates. We listened to content experts, but the emphasis was on context experts. So these are individuals directly from the community speaking about their experiences with social determinants in Allentown. I also have to give a special thank you to Dr. Batts, Ola, Mary Ellen. Thanks to this concept of radical welcome, I felt a sense of belonging and safety to discuss difficult but very important topics that address health inequity. And it really helped me step out of my comfort zone because that's where change happens. And then for our projects this summer, Abby went over our storytelling project, or our LMS project, and I'm so proud of the work we did. We tried our best to get a lot of resources, social media accounts, phone numbers for community centers, podcasts, anything we could think of to really provide resources for the community to combat social isolation. And then we also created a storytelling project, and I had the pleasure of interviewing Christopher Stout. He is the coordinator of the Clubhouse of Lehigh County, which is a mental health community center in Allentown. I created a collage to represent the Clubhouse's mission to provide employment, wellness, education, and a membership for life. I was so inspired by Chris Stout and the love he had for his community. It was very moving. And lastly, for my personal reflection, you can read it, but I think the gist is, once I learned that your zip code determines your life expectancy, and once you're exposed to social determinants of health in your community, it's hard to look away, and it's, for me, impossible to ignore. So everything I learned through Bridging the Gaps and everything I've learned in my years at DeSales, I hope I can take these virtues and values as my career progresses in nursing. And I hope I can be an example to others so we can address and end inequity together. Thank you.
Thank you so much, Chelsea. We really appreciate your comments. Why do I have blank things here? Oh, you know why I have blank things here? My file was too big and I had to send it as a second file over to Ola. So I have part 2 to pull up. I'm sorry. Let me see, screen share. So I have to do new. I have to pull up the next one, part 2. Okay. I hope everybody can see this. Dan Phillips now from Marywood. He'll be the next speaker.
Great. So, hi everybody, I'm Dan. I'm a second-year social work student through Marywood University at their Lehigh Valley campus over at DeSales. As some of the others said, two of our main projects that we went over were the learning modules that we created in groups and the police reform project, and that was really helped out by the community stakeholders and the context experts that we were set up through Promise Neighborhoods to talk with, listen to, and interview. And I gotta say, yeah, thank you to Dr. Botts, Ola, and those community members. I know a couple of them are in the chat here, for taking time and setting this up, because it really lent a deeper understanding to everything. A lot of what we did was looking at the social determinants of health and the racial, cultural, socioeconomic status differences, and how, the policies, the historical context, the inequalities in healthcare in the Lehigh Valley and in the country as a whole. It was a good history course and a good explanation to the experiences that were shared by these members were really impactful and not something I'm going to easily forget. And throughout all this, I was able to learn a lot about resources in Allentown, what's needed, what was already there, and learn about some new things such as the Ortiz Arc Foundation, which I wish I knew about a while ago. And the focus on self-reflection and as a major component of this fellowship was very valuable. I felt it was extremely valuable, especially with our police reform project and our discussions that we had following it, especially what, how we approached it and how we approached our work in general was called into question, but always in a supportive manner. And echoing what Chelsea said, we felt comfortable talking about those things, and that's where change happens. So, Mary Ellen, can we go next? Oh. All right. So, the learning module. Charlene and I, we worked on housing in Allentown for our learning module, which was a huge topic, and it was really hard to focus on just a couple things. Ola was fantastic in helping focus that, and Dr. Botts and Paz in our feedback meeting were really helpful in determining what the community would probably benefit from the most. So with the short amount of time we had, we tried to construct information on housing resources for anyone experiencing housing insecurity, as well as educational materials on housing rights for tenants. And we were able to, through our interviews, talk to individuals such as Jessica Ortiz, who's a licensed realtor in the area, and talk about what are some helpful things for tenants, such as mediation in the Lehigh County court system that can help maintain housing for individuals and educate tenants and landlords on their rights instead of evictions. So it was a really helpful experience. And we tried to add some advocacy aspects to the end of the presentation as well, as best we could. So in summation, we're taught a lot to listen to the community in school, but in practice, through the interviews, I felt that wasn't always the thing. And reacting to that information from those context experts in a proactive way is something that I will take with me in whatever facet of social work wherever I end up going on from here. And the connections between policy, health, race, and policy you can't look away from it. And it's very much a part of our daily lives, as well as our our work lives, and I have a much better understanding of it coming out of this. And lastly, it's good to have a name to put towards the radical welcome, always remembering to treat each other well and welcome anybody, no matter what, preconceived notion you might have about them. Throw that out the window. So, yeah, thanks.
Thank you, Dan. Next will be Dan's partner, Charlene Weiner.
I don't think I saw her on here. I'll give her a call.
Oh, when you look through the screen, you didn't? Okay, I didn't hear anything from her that she was unable to attend. Well, what I'll do is I'll walk through these slides with what Charlene sent me. It concentrates on the police reform project in the beginning, how she worked with Dan to review published literature regarding police reform. And then she utilized information from this into the PowerPoint she developed with Dan for Ola and Dr. Botts to be used in the future for educational purposes through Promised Neighborhoods of Lehigh Valley. And these are the bullets, 5 really big proposed changes. Community-led board of stakeholders to advise on public safety issues, more transparency in the budget, police training addressing racial bias, policies surrounding police body cameras, and trying to remove the double standard for accused police. Then the housing and action in Allentown project that was done, some investigation found that 2 big definitions, one is from the American Heart Association for Healthy Homes, that housing status and location are strongly associated with health. And a healthy home provides safety, shelter, and is well maintained and affordable. And that goes back to the commentary about zip code being a really strong determinant of health. And when they interviewed Jenny Garcia, her definition was that a healthy home is being able to pay your rent, having security, not worrying about being evicted, a safe place for your children to sleep at night, groceries in the refrigerator, and at time, even if it's a shack, it's better than being outside. So the other part of the housing and action in Allentown was the role of healthcare workers to provide housing assistance, the relationship between housing and heart health, because Bridging the Gaps has a focus on heart health for their overall programmatic activities, the pathway of housing to health, stability, quality, safety, affordability, and actual neighborhood, and then tips on the housing process and the importance of knowing your rights. And lastly, her personal reflection is here that, she talks about how people in her own community face so many adversities, and as a future healthcare worker, she's now better able to be more informed because she now knows more about patient-centered and trauma-informed care. So she feels like she had a good professional development this summer in the 7 short weeks. She can be a better advocate in fighting for health equity. And she was grateful for this opportunity to represent Bridging the Gaps in Moravian College to assist Promised Neighborhoods of Lehigh Valley. So those are Charlene's reflections. Next, we're going to go on to Emelyn Cruz. Emelyn?
Hi, my name is Emelyn. I am a senior nursing student at DeSales. So this summer, some of the internship activities that we did were webinars every Monday. So that's how we started off the week. The Promised Neighborhoods hosted an 8-week-long series. Some of the topics that they focused on were like the school to prison pipeline, youth violence, social determinants of health, and chronic illness. So the chronic illness webinar was significant for me and my partner because it emphasized the need for culturally competent providers in the Lehigh Valley, and how minorities who deal with chronic illness also have to constantly be in and out of the hospital and have to experience incompetent providers the most. The Wednesday webinars were with the Philadelphia interns, and they talked about really hot topics such as police brutality, the Black Lives Matter movement, the opioid crisis, HIV. Those were all things that, as we know, this summer, a lot of things happened and a lot of everything just got crazy. So it was like important to talk about it. And we also did a lot of interviews with community members, which gave us direct insight on what the community members think that the community needs. So that has to do with the model of the community-based participatory research. So that, like the other interns mentioned, only the community knows what they need, and our role is to be a resource, not to tell them what they need. So for our learning module project, me and my partner did culturally competent providers, and some of the things that we did were interviews with Dr. Alang, Jessica Ortiz, and Yamelasa. We learned that the Lehigh Valley is composed of more than 75% minority group, but most of the providers are not from here, so they don't understand the needs of the population they serve. Through the focus group, we talked to community members, and they gave us messages that they thought providers should know about and what they expect from the providers that are working in the community. So with all of these things, we were able to form a module in which we outlined what it means to be a culturally competent provider, how to become a culturally competent providers, as a patient, how to look for a provider that's competent. And then we even had a small list of providers that people in the Lehigh Valley actually suggested that were culturally competent. And then my personal reflection, being that I live in Allentown, I became more aware of my own community and how you don't know what they need unless they tell you. So this will help me in my professional career, because I will be able to be more, receptive to their needs. So the Bridging the Gaps internship opened my eyes to all these hardships and the importance of recognizing these disparities.
Thank you so much, Emeline. And Emelene's partner was Noel Kelly, also from DeSales University. Noel.
Hi, everyone. My name is Noel, and I'm currently a senior at DeSales University and part of the graduate program for the physician assistant program there. I would like to start off by just saying that this internship was a very transformative experience for me and has opened my eyes to so many of the injustices present in our medical system as well as our society that I had never considered before. I also would like to thank Ola, Dr. Batts, Mary Ellen for just leading the way on this incredible journey this summer for me in expanding my worldviews. And I'd also like to thank the fellow interns for creating a space that was safe to discuss these issues and really just grow together. So right from the beginning, an impactful activity we did was a windshield assessment of the community of Allentown to get an understanding of what life might look like for the people who live there. But instead of driving around, we actually had to do this using the internet and Google Maps because of current COVID situation. One thing I noticed right away looking at the map of the area that I might not have noticed driving around was the lack of larger chain grocery stores. And there were a lot more family-owned corner stores instead. At first, I thought this was a negative thing, which I learned in a Monday webinar that in a way it is, in the fact that it contributes to food scarcity where people have less access to fresh fruits and vegetables that are affordable. But on the other hand, one thing that community members, Jose and Yamelisa, had mentioned in their Monday webinar was that I would not have thought of myself, was that these small corner stores are actually really important because they keep money within the community and are more personable and caring for their customers, even offering credit when they know that the people that go to their store are in a tough spot. So I thought this really demonstrated to me the promised neighborhoods ideal of the community members being the experts in their own lives, as I would have never considered this myself being an outsider. Additionally, all of the Monday webinars were really informational and eye-opening. The one that really stuck with me the most and has motivated me to want to be a better provider was Yahara Washington's story about her poor treatment when making a simple request for clean bumpers on her bed something that should have had an easy solution and yet escalated into a problematic situation very quickly. She also made the points during her presentation about how when seeing patients, you have to remember that your 15 minutes might be someone else's several months wait. And I think that this is a really important concept to keep with me as I continue into my professional career to ensure my patients receive proper care that is personable. My favorite part of the internship was definitely getting to speak with community members and learning from their own life experiences. I would like to personally thank everyone I spoke with and express my gratitude for their willingness to open up to me and share their stories and opinions with me to help me grow in my professional development. My interview with Dr. Lang was particularly impactful for me as she introduced me to the concept of cultural humility, which is the idea that I don't know enough and I'll never be able to know enough about how someone's culture influences their health, but I'm always going to try and learn better. So I would like to continue keeping an open mind and be willing to learn about my patients' cultural views so I can provide them with the best care that I can. And then for the police brutality project, I was responsible for researching how police brutality negatively affects health of oppressed groups. And I was very astonished at the amount of data demonstrating that over-policing and policies like stop and frisk are very clearly leading to poor health outcomes due to stress of the police constant presence in these areas, and yet little has been done. So I was just very surprised by the fact that there's so much data on this and yet little has been done up to this point. And then lastly, the main project that I completed this summer with my partner EMELYN was on culturally competent providers. And we covered a lot of information in our PowerPoint, but I just wanted to go over some of the main points and the main takeaways that I got from it for me. So the one thing that I learned about that I didn't know about before was about critical race theory, which is an anti-racist movement that works to address structural racism, that's still present and challenge the idea that we currently live in a colorblind society. And an important component of this is people telling counter stories of their experience with structural racism in all areas of society. I was also responsible for reading Dr. Lang's article on lack of cultural competency in the mental health system for Black Americans. And I was shocked by the amounts of participants in the study that had stories about microaggressions they experienced while receiving care, and how racism and oppression manifested in mental health care offices. In the presentation, we also addressed the lack of required education for providers on how to be culturally competent and how universities can adjust their educational requirements to reflect the importance of learning about critical race theory. And in the last part of the presentation, we focused more on the Allentown community. From talking to people in the community, we're able to come to the general conclusion that many of the providers in the Allentown area are not culturally competent and do not treat their patients with the respect they're right to, although there are also many culturally competent providers that we also added a list to at the end that EMELYN mentioned. And we added a list of suggestions for people in the community about how providers, we then listed suggestions for providers in the community on how to be more culturally competent. And we gave people in the community a list about how they can find a culturally competent provider for themselves. And then the last thing I'll do is I'll talk a little bit about my personal reflective statement. Sorry, hold on. So this internship has really enlightened me on the many adversities that people face in the community when I become a physician assistant. And I think that understanding the factors that may limit their access to care or prevent them from following a specific treatment plan will enable me to provide the best quality of care for my patients that is trauma-informed and culturally humble. Personally, I really enjoyed working with my interdisciplinary group of interns, as I felt it helped me learn the importance of teamwork-oriented environment. Speaking with community members about what life is like in Allentown really educated me on how inequity is immensely present in our society in a structural way. I believe that this internship has expanded my worldview extraordinarily and has motivated me to remain a lifelong advocate for more equitable healthcare practices and policies. Thank you for your time.
Thank you, Noel. Okay, I would like to just say that if we were all together in some type of an auditorium or some formal session, we would all be applauding you, right, all 6 of you right now. And I would just like to ask everybody who's on the session to do that. If you're muted, we're not going to be able to hear you, but I think these interns really do deserve all our applause. I met with them, some of them in the fall of 19 and some of them in January and February, and finally in March when we all met finally telephonically to say, you know, you have a slot in the internship. Then our world changed and our state was closed down effective March 19th, I believe it was. So I just want to say that these 6 young budding professionals hung in there with me because I was having every other week, and then it turned out to be weekly meetings with the entire Bridging the Gap network of directors. We were having conference calls to try and strategize how we were going to be able to do this as a remote experience. And then I was reaching out to my organizational contacts in the Lehigh Valley to see how we could actually work with them in a remote way. And then when we hit so many roadblocks with summer camps not running this year and with other facilities and organizations not being able to do a remote experience, it was only because, as I already said, the blessing of the Promise Neighborhoods of Lehigh Valley just said yes. And then not only to say yes, but to, yes, I'll take, you know, we'll have all 6 come. So again, thank you so much, Dr. Botts, for that. But I really want to applaud the 6 interns for the summer of 2020 because they truly are groundbreaking interns who took a quantum leap and who said yes to being an intern when they thought they were going to be doing the typical summer experience where they were assigned to a community site for 7 weeks and they were going to be interacting one-on-one and in small groups with educational sessions and all that. So for these young professionals to do what they did this summer was no small feat, and they're really to be commended for their professionalism and their ability to accomplish the tasks at hand. So thank you, thank you, thank you. So now I'm going to turn over the session to Ola, and she's going to move us forward.
Thank you so much, Mary Ellen. I'm going to share my screen now. Start here. Okay, perfect. All right, so I just want to echo everybody and thanking all who were involved. I want to extend a special thanks to the Promise Neighborhood, Dr. Batts, and all of the staff really who welcomed me, and all the forces that aligned that I would be able to participate in this project. So I have had the opportunity to fall in love with Allentown and the people. They have been very intentional about their learning and about their collaborative efforts to really make this project something meaningful and also to raise up and uplift the voices of community members. So I'm going to be talking a little bit about the webinar series. So we had 2 really exciting portions of the fellowship. So you've heard from the students about their involvement in the really intensive project building and learning in terms of health equity and the social determinants of health given to them by the community members and through the lens of Dr. Batts' research and work. There was also a webinar portion that was initially looked at as a resource for the students for the fellowship, but Dr. Batts, if any of you know him, then you know that he is very innovative, to say the least. And so at some point during the
envisioning of everything, he decided, you know what is really important here is that we open it up to the community and make it community centric. And that was the best idea, because the students, I feel like, were really even more enriched by that experience. And it also had the double impact of continuously lifting up the community in their dialogue with the content and context experts. So the first thing that I have on the screen is a word cloud that I tried to keep it in all of our PowerPoint presentations during my time with the students, just to remind them about what they said to me on the very first day, right? So I wanted to keep this up here so that you all could see that the students were excited. They continue to echo these thoughts. These are things that they said going in that they were looking to experience. And I think from hearing their feedback and their learnings, I think that they really did achieve all of what's seen on the screen here. So I want to make sure you guys could take that in. All right, so this is a very brief presentation, or part of the presentation. I'm just going to go over the mission, the impact, and the charge, right? So our initial mission was stated every week on our webinars by Julie. She is not, I don't think she's on with us right now, but she was a really integral part of this fellowship and in the designing of the webinar series. And she continued to serve as a resource in welcoming and introducing everyone, and also just leaning into, you know, it's really powerful the way that she leaned into the content and context experts and really raised their voices. So every week she would read this. I'm gonna read it, not as well as she would, but I'm gonna say what our specific goal was. The PNLV Health Equity Fellowship is centered in the idea that wellness is a basic human right and that everyone is worthy of a fair and just opportunity to be as healthy as possible. We recognize that locally significant obstacles to optimum health exist, such as racism, power imbalances, and poverty. These oppressive factors, as well as inequities across the social determinants of health, substantially disparately impact the health and life outcomes of marginalized and vulnerable communities. We will recognize the scholarship, leadership, and opportunity for partnering with local context and content experts to provide an understanding and the foundations of health inequity and to develop the next generation of healthcare leaders. Community members and leaders will work to disrupt the pain and damage inflicted on marginalized communities by the healthcare system and to equip them with the knowledge, community, and courage to build more equitable organizations and communities. There were just some words that really jumped out to me during my participation, and I wanted to highlight those things so that you all could see how important this work is and what we are continuously striving to do. Okay, I have a video here that I'm going to play for you all. It's about 6 minutes long, and it's a smash up of reflections from the content and context experts. I wasn't able to get everyone in, so I just pulled away. Some of them are reflections that were produced just for this video, and some of them are me just taking out excerpts from the recorded webinars. I think it's really important for you all to see the faces of those who really are responsible for this major work. Dr. Batts coined these terms for me, a content and a context expert. So he does the best at describing them, but when we talk about context expert, we're talking, well, I mean, I'd like to explain it better the other way. So when we talk about a content expert, we talk about someone who they have studied, they have learned, they have expertise in the field based on their learning, either from a book or from a class. They have dedicated time to studying a subject. And the context experts are those who are living the experience, right? We were very fortunate to have content and context experts who were so deeply rooted in the community that there was continuity across the board, right? So we worked really hard, and I believe the students can attest to this, how important it was for them to, when they did their research, make sure that they were being equitable in the way that they were looking for experts. So when we call someone an expert, are we looking to people of color? Are we looking for people who have lived experience? So we were really fortunate to have people who were experts in their fields and also context experts in the fact that they had lived these experiences. So I'm going to go ahead and play the video. Hopefully you guys can hear it from this. Well, let me make sure that Dan actually taught me that I need to click this button at the end to share my computer's sound. Okay, so hopefully you guys can hear from here. If not, I'll just pull it up.
My people, you know, wherever we go, you know, I can walk through the building, you see our people, you see Dominicans, you see Puerto Ricans, you see Vietnamese, men, women of all ages, races, colors. Our programming has to reflect the beauty. We have Cheyenne Riddick here. Hey Cheyenne, say hello.
Hello.
We have Cheyenne Riddick here. She eating healthy food too, vegetables and all that. I mean, the building is full of us, man. So thank you, Ola. What I will say is, so two of the things that we focus on, our flagship program, Promise Neighbors, we didn't talk about, is Leadership Without Limits. How do we build the next generation of leaders? That is our flagship program. With that, we have a program under Leadership Without Limits called Inside Allentown, and it takes people through 10 sessions of the city of Allentown and how things work so that they can get involved. So to give you an example, we've had about a handful of marches over the last couple of weeks. And so one of the first ones, one of the first ones in the youth-led one, what I noticed, because I haven't been involved in any marches, but of the 8 or 9 speakers at the one march, 4 of them came through our Leadership Without Limits program, Rodney being one who was bold and courageous. And one of them, Enid Santiago, came through our Inside Allentown program. Was a graduate of our Inside Allentown program. And the Youth March, one of the organizers came through our program. 2 of the 6 speakers came through our program. So we're seeing our footprint throughout this city in building a next generation of leaders so that we can step back. Cynthia and I can step back. And
hello, everyone. Sharon Fraser here. Thank you to PNLV and the principals of who put together the Health Equity Summit and their supporters for inviting me to participate in the summit, and also for Katara for being my partner in the food apartheid section of the summit. I looked back on all the other participants, all the other experts who spoke about the social determinants in health, and found it very interesting. I learned quite a bit myself, and I think it's really important that you meet the people where they are and you go to them to find out what they need. And this was, I think, one of the intent of this summit, to really help determine policy for the future. And by taking a grassroots approach to it, I think we got some of the elements that are needed to probably improve healthcare, and to give the young people who are learning, the people who are participating in the system now, who are learning to be doctors and nurses and administrators and social policy makers, to look at a wider lens, to look at healthcare in a wider lens, and to bring in a more equitable policies and put them in place. So I want to just tell Hassan Batts and his team and all the principals who were in charge of this, Julie Thomason and so forth. Thank you very much for inviting me to be a part of it. I enjoyed doing my part of the series, and I look forward to hopefully having something like this better next year. And again, thank you so much. Bye-bye. Okay, so
my story. So when I heard it, it's like, oh yeah, all that. And then I'm hearing Jose's and I'm like, yes, yes, yes. I mean, it's such a beautiful thing to hear. As you shared, being in the field of substance use and recovery for 14 years, I get to watch it hands-on, but not firsthand. And I recognize that. And, my teachers are Jose, and the Jose's that I have had the pleasure to know through my time in substance use counseling and all the different levels of it. So it's just beautiful to be able to have this conversation today, and I am so grateful to to have this opportunity. So Jose, for you also, thank you. Did you want to say some words? No? He's shy, guys. He's shy.
Good morning. My name is Michonne Roberts. I just want to say thank you for attending the seminar that I was hosting or co-hosting with Dr. Seri. We were speaking about social determinants of health. That particular seminar has impacted me, and I hope it's also impacted people who were able to view it. It gave me an opportunity to really, brainstorm some things with other people and get some better ideas with how can we go about making social changes in our community when there are disproportionate opportunities to those that are available. So that allowed me to really think a little bit more outside the box, and I hope it impacted anyone else who was also involved. Thank you so much for the opportunity. It was definitely my pleasure. Have a beautiful, beautiful rest of your day.
And they're not really respecting my parents. So yeah, I just wanted to share that story with you guys. Well, those two stories with you guys. Thanks for giving me this opportunity.
Any more questions out there?
This poll is awesome. Did you see this, Jessica?
No, I have not seen the poll. I don't know where to
Thank you. They gave us like an A.
Yeah.
Yay.
That's awesome.
Actually puts rules and policies in place that shows that. I'm so sick of hearing people say how much they value diversity, but yet your policies don't show that you do. So until we have policies in place that show we value diversity and we want people here who are diverse, I don't want to hear about how we do it. I don't want to hear it no more. I want to show me.
All right. So I am not, hold on. Okay, there we go. I'm not a video editor or a graphic design or any of that type of thing. So I hope you all were able to enjoy that. I just wanted to pull out, there's so many wonderful moments, and I wanted to just pull out some things that will help you all get a snapshot of the impact that we had the content and context experts had an impact on us, certainly. And this fellowship opportunity had an impact on them as well. And so I wanted to make sure that you were able to see that. Okay, so this last slide is a charge, right? And I wanted to use that word because I feel like it's very loaded. Instead of saying like next steps or what should we do next, I wanted to use a action-packed word that really let people know that this is an exchange, that it's not just promised neighborhoods of the Lehigh Valley and the people who are directly impacted by the health disparities that are taking this up and doing this work on their own, that there has to be an exchange between people who are in systems of power. So there's a charge, right? These are a couple things that I just wanted to highlight of next things that we would need to really continue the work, especially in the virtual webinar format. So we need call to actions, right? The community needs actionable takeaway points and charges. So after each webinar, we really want to have the ability to give the community and the larger community, not just the people who are members of Promised Neighborhoods of Lehigh Valley, but also those who are in the positions in the healthcare system and in in city government, and the people who are in charge of policy and housing and all the things that we've come together to do work around. We want to make sure that when you leave the webinar that you know what you can be doing to make an impact to yourself and your organization. We need a space for continued dialogue. So this could look like social media, Twitter feeds, Facebook groups. I felt like some of the topics and the presenters introduced things that were probably really heavy and possibly triggering to people who have experienced the traumas of being in vulnerable, disenfranchised communities, and also eye-opening for those people of privilege who had not yet had such an intimate conversation. So it was really powerful that was, you know, that the top was let off of that box and that the audience was able to see that. However, you want to be able to continue to have that conversation, make a space for healing, and also make a space for restoration. So we also need more investment in speakers packaging their stories in valuable information about achieving equitable conditions, right? So that's something that is really powerful about having the content and context experts. A lot of the context experts had never been in a situation where someone asked them, what's your story? What do you have to say? And told them that they were an expert on this subject matter. So we really want to invest in our community. We want to invest in people. We want to help them build out their stories. We want to help them understand things about what has happened to them. And we want to build them up to be the best versions of themselves, right? So we need support in doing that. We need a way to maximize impact through sharing. So we are really working to digitize everything and package things so that we can just, you know, send people a link or send people a video. But that's, we live in a time where things can go viral, right? And so we want the right things to go viral. We want this type of information where our community members are sharing solutions and sharing their stories, counter stories, as Noel mentioned. So we need a way to maximize that. We need language around communal information exchange and non-traditional presentation styles, right? So the audiences need to be trained to receive and value information shared that way. So it was really cool because it was so informal some days, and people were being really authentic and raw and non-traditional. And when you are from a certain community, when you are used to having these dialogues and receiving information that way, it feels like home. You feel like people are speaking your language, right? And so we need to make sure that we're honoring that and uplifting that, and that, you know, all the educated folks in the room are able to really be in cohesion, right? So that we understand that we are presenting in a way that's different than what you may be used to presenting it. I know we're running pretty short on time, so I just want to highlight the last three. Some of these things are just about what things we need for our webinar platform, right? So we need features that include more dynamic live polling, Q&A, more audience participation, and then we really do want to be more targeted in the future in the way that we build out the webinars, right? So strategically, if we want to do content that's around schools, we want to make sure that we market that towards people who are involved in the school system. So the last thing I'll do, if I have time to do this, Mary Ellen. No, I don't really, but. So the students are familiar with this, but what I'm going to ask for everybody to do is to go pull out your smartphone, or you can use your web browser, and go to www.menti.com. This is how we're going to do another word cloud. And so then you type in this code. And once you type in the code, it should bring you to a screen where you can answer this question. And as folks answer the question, the words are going to pop up on the screen. So we're going to see live results here, and we're going to be able to capture this so that we can use it in the future to say this is a part of the evaluation and research of the webinars, right? So if you guys could just take 1 minute to do that. Very cool. I really love to see it just the way that it works. It's very cool. So, and also, if you're not familiar with word cloud software, the larger a word is, the more people enter that. So it's a way for you to really see, to pull out trends. So this is really great information that you all are providing us with. Very cool. Okay. So thank you so much for letting me talk to you guys about the webinar portion. Oh, I see it's growing still. It'll continue to grow as you guys enter things, but I want to go ahead and turn it over back to Mary Ellen.
Thank you so much, Ola, for all your dedication to the interns this summer and the Health Equity Fellowship. I typed in the chat screen that if anybody had a question, they should type it here. And we've gotten a lot of kudos and a lot of positive reinforcement type of statements. There were a couple questions, and Dr. Botts did respond that things are going to be sent to those of you that want them, and things are going to be posted on their homepage. But does anyone have a question? It's your turn to post it, because we're going to close out with having Dr. Abby Lecter, my colleague for the last 13 years here in the Lehigh Valley through Bridging the Gaps, speak to us about wrapping it up and pulling everything together about what we've been talking about this afternoon. So Dr. Lecter.
Hi, everybody. What a great evening so far, and thank you to the students and to Ola and Mary Ellen and Dr. Batts for making this happen in this way. I think it's wonderful to see and hear and catch up and build our community. So I'm here to sort of bring home our message that the charge here is to practice radical welcome throughout our lives together in community, and that health equity is community work and community work is health equity work. I think one of the things that always makes me a little worry is when something becomes a buzzword, then maybe it starts to lose its power. And so health equity, we have to maintain what is the real truth and the power in this work of health equity together. And I'll share with you that my pathway for that is through radical welcome. So briefly, when I think about radical welcome as a clinician, and you, my darling new content experts that are coming through, and many of the rest of us who are out there as the content experts, I'll share that I use this for my clinical work and I use it for the change work too. And you've heard it before, right? So radical welcome begins with everyone has a story. We need to be expert listeners and hear and look to what is the story that each person we encounter has to tell us. Be that listener, learn to fall in love with the story. Everyone has a story. Goes from there to everyone has the capacity to heal within themselves. Everyone has the capacity to heal. As clinicians, we aren't here to fix people. We aren't here to do to people. We're here to be with people and help you find to be real partners. How do you help someone find within themselves the power to heal? When we try and fix, when we try and do to, we will miss the point. So how do we listen to that story and give someone their own power to heal? Relationships. Healing happens in relationships. As a clinician, it's my job to make that room through the relationship, and these are authentic relationships, and you've been talking about this, I think, all summer, about what is an authentic healing relationship, and it's a relationship that's not about the transaction. It's about finding out what is special and wonderful about each person, and how do we generate power and learning and love together. Then our last piece of the radical welcome, healing happens in relationships. And where do relationships happen? Relationships happen in community. And for me as a clinician, it's such a reminder that whatever happens in an exam room, That's just a tiny part of somebody's life. That people leave the health center, they go out to live the rest of their lives, and it's important that I know and understand that and honor that. And part of our healing path together is for me to help think about who are the relationships and where is the community that matters most for each person. So that's my pathway for radical welcome as a clinician. As a change agent, what I'm looking for is how do I use these same principles, listen for the stories, know that there's the capacity to heal and the capacity for equity, make room for that to happen, find the relationships, join those relationships, and build the community. And one of the things that we don't necessarily talk about as much, we talked a lot about how we have to find the culture of humility, we have to listen, we have to be prepared to learn in a different and new way than we have as content experts and professionals. What we haven't talked about as much is about power. And that as a change agent, part of our job as content experts is that we've been given a certain kind of power. And we need to mobilize that in partnership with our community members. We need to be able to join that community, think of it as our own when we have that invitation, and think about how to leverage power. So listening at a systems level for systems change. How do I find out where there are leverage points for change, and how do I bring those leverage points to the community and get that kind of input so that we can make the changes happen. So sometimes we're conduits. It's about making space. The challenge can often be that systems are built to do exactly what outcomes they show us, right? These aren't broken systems. These are systems that are working just fine. And they might push back when we're asking for change and when we're looking for ways to practice radical welcome because they're designed for something else. But as change agents, we can be listening for those leverage points and making sure that we're standing up whenever we have the opportunity to say, health equity work is community work and community work is health equity work. So what our charge will be moving out there is to be brave. Be brave and stand up, be brave and make those counter stories available, make space for the counter stories to be heard, and be brave also to change those systems, build the new community, make the new programs. We'll hear all the time, this isn't the way we do things. But as a change agent and as the content expert who has access to some of those places where maybe we can find the leverage for change, it's our job to stand up and be brave. And the good news is that when you're partnering in community and you found your people and you know that you've got your fellows and you've got community partners and you have allies that you're building all the time, that even in those moments where it's difficult to be brave or where it hurts to be brave because systems fight back sometimes, you've got a community and a team that's there to support you. So that's what we can commit to being for each other. Be the one who can help hold someone up today because that person will hold you up tomorrow. So I encourage us all to practice that radical welcome. There can be no health equity work without community work, and community work is health equity work. So thank you for being here and being our partners. And I think "and" is such a great word. So and. Mary Ellen, let me turn that back over to you, and let's be brave.
Thank you for all your messaging, Dr. Lecter. It was just fabulous. And I actually want to turn the session over to Dr. Botts, who gave us the radical welcome. He can now provide us a radical exit.
In closing, Now I need you guys to listen real careful to this, right? Carefully. In closing, what I'm going to leave you with is ditto to everything that Abby said. That's it. It stands on its own. Thank you for joining us. Thank you for being our allies, our accomplices, and our co-conspirators in this work. We follow that Ubuntu principle. Yo soy porque nosotros somos. It says, I am because we are. Therefore, because we are, I am. We're in this together, and we will be the change. Thank you very much, guys. It was a pleasure.
Thank you.